Good morning, everyone. This is Dr. Mayank Kulshrestha, working as a senior assistant professor, School of Pharmacy, BBD University, Lucknow. Today, we are going to discuss the respiratory infection, regarding the cholera, regarding the malaria, which is a part of the subject social and preventive pharmacy. The subject code is BP802, which is a part of B from 4th semester 8th sem. So, firstly, the content of this presentation, the prevention control of the some these diseases, the cholera, the SARS, the influenza, the acute respiratory infection, and the malaria. Respiratory infection may be two types: the acute respiratory infection or the severe respiratory infection. So these both are the part of respiratory infection. So we can discuss one by one. Respiratory infection or respiratory tract infection are the infectious disease involve the respiratory tract. An infection of this type is normally further classified as upper respiratory infection, which is called URTI, or the lower respiratory tract infection, which is called LRTI. Lower respiratory infections such as pneumonia tend to be bare far more serious condition than upper respiratory infections such as the common cold. Means common cold is the infection of common cold is the example of upper respiratory infection. The pneumonia is the example of lower respiratory infection. The upper respiratory tract is generally considered to be the airway above the glottis or vocal cord. Sometimes it is taken as the tract above the cricoid cartilage. This part of the tract include the nose, sinus, pharynx, and larynx. The lower respiratory tract consists the trachea, bronchial tubes, bronchioles, and lungs. Lower respiratory tract infection are generally more serious than upper respiratory tract infection. Lower respiratory tract infection are the leading cause of death among all infectious disease. The two most common lower respiratory tract infection are bronchitis and pneumonia. Influenza affect both of the upper and lower respiratory tracts, but sometimes dangerous strains such as highly precious H5N1 tend to bind to receptor deep in the lungs, so it is more dangerous the respiratory infections. Now we are going to here you can clearly picture in picture you can clearly see the respiratory tract infection versus healthy, and the second one is infected. So there is mostly disturbance clearly seen in the infected respiratory tract. So the thin of the mucosa, the mucosal layer, everything has disturbed in the respiratory tract infection. Now we are going to discuss the acute respiratory tract infection. Acute respiratory tract infection is an infection that may interfere with the normal breathing. Means all respiratory tract infection interfere the breathing, but it is interfere the normal breathing. It can affect just your upper respiratory system, which start at the sinus and end to your vocal cord, or just your lower respiratory system, which start at your vocal cord and end of your lungs. The causes of upper respiratory infection include the viruses and bacteria. There are some viruses are rhinovirus, adenovirus, coccicovirus, perine influenza virus, respiratory critical virus, human metapneumovirus, and some bacteria are group A beta hemolytic streptococci, group C beta hemolytic streptococci, Corneobacterium diphtheria, Neisseria gonorrhoeae, which is the causative agent of gonorrhea, Chlamydia pneumoniae, which is the causative agent of chlamydia. So these are the some causes of acute respiratory. What are the symptoms of acute respiratory infection? The basically in the system include system experience the upper respiratory infection include the congestion either in the nasal sinus or lungs, running nose, cough, sore throat, body ache, fatigue. Immediately call the doctor if you have symptoms like a fever 103 degree Fahrenheit, chills, difficulty in breathing, dizziness, loss of consciousness. What are the some other cause of acute respiratory infection? There are different causes of acute respiratory infection. Some are the acute pharyngitis, means the infection is pharynx. acute ear infection, common cold. Causes of lower respiratory infection are bronchitis, pneumonia, bronchitis, bronchiolitis. So these are the some these are the some causes of respiratory infection. How is acute respiratory infection diagnosed? In a respiratory exam, the doctor and nurses focus on your breathing. They will check out fluid and inflammation in the lungs. By listening for abnormal sounds in your lungs when you breathe, the doctor may peer into your nose and ear and check your throat. If your doctor believes the infection is in the lower respiratory tract and X-ray and CT scan will be there. The lung function tests have been useful as a diagnostic tools. Pulse oximeter, also known as pulse ox, can check how much oxygen get into the lungs. A doctor may also take a swab from your nose or mouth and asks to cough up a sample of sputum. Sputum means the material coughed up from the lungs to check for the type of virus bacteria causing the disease. So this is the mean why we can check out the acute respiratory infection. How we prevent an acute respiratory infection? Most causes of the acute respiratory infection are not treatable. Therefore, the prevention is the best method to ward off harmful respiratory infection. Getting the MMR, measles, mumps, and rubella. In short, we are calling MMR and pertussis vaccine, which substantially lower your risks of getting a respiratory infection. You may also benefit from influenza vaccination and pneumovirus. Talk your doctor about getting these. You should also avoid smoking and make up your include plenty of vitamins in your diet, such as vitamin C, which help boost your immune system. Vitamin C is a maintained in immune cells, and a deficiency has been linked to higher susceptibility to infection. While research is unclear if vitamin C can prevent an acute respiratory infection, there is evidence that it can shorten the length of time or severity of the infection. Now we are discussing about the severe respiratory syndrome or severe SARS. Severe respiratory infections is a viral respiratory disease caused by the SAR associated coronavirus. So the coronavirus is the best example of SARS. It was identified at the end of February 2003 during an outbreak that emerged in China and spread out in four countries, and basically spread out in the four countries. So basically, it is China. Originate from China. Now, WHO coordinated the international investigation with the assistance of the Global Outbreak Alert and Response Network and work closely with health authorities in affected country to provide the epidemiological, clinical and logistical support and to bring an outbreak under control. SARS is an airborne virus that can spread through small droplet of saliva in a similar way to the cold and influenza. It was the first severe and readily transmission new disease to emerge in the 21st century and showed a clear capacity to spread along the routes of international air travels. SARS can also be spread indirectly via surfaces that have been touched by the sometimes who is infected with the virus. Mostly patients identified with SARS were previously healthy adult aged 25 to 70 years. A few suspected cases of SARS have been reported among children under 15 years. The case fatality among persons with illness meeting the current WHO case definition for probable and suspended case of SARS around is 3%. So this is the condition of SARS coronavirus. The incubation period of SARS is usually 2 to 7 days but may be as long as 10 days. The first symptom of the illness is generally fever, which is often high and sometimes associated with chills and rigors. It may also be accompanied by other symptoms. including headache, malaise, pain. At the time of illness, some cases have mild respiratory symptoms. Typically, rashes and neurologic or gastrointestinal findings are absent. Although a few patients have reported diarrhea during the early febrile stage, after 3 to 7 days, a lower respiratory phases begin with the onset of a dry, non-productive cough or dyspnea, means shortness of breath, and may be accompanied by or progress to hypoxemia, low blood oxygen level. In 10 to 20% of cases, the respiratory illness is severe enough to require intubation and mechanical ventilation. Chest radiographic may be normal throughout the course of illness throughout for all patients. The white blood cell count is often decreased early in the disease and may people have low platelet counts at the peak of disease. So this is the condition of SARS. There is no cure or vaccination for SARS, and treatment should be supportive and based on the patient's symptoms available. Now, the controlling outbreak relies on contamination measure, including the prompt detection of case through good surveillance network and including an early warning system. Isolation of suspected or probably cases, tracing to identify both the source of the infection and contact of those who are sick and may be at risk at contracting the virus. Quarantine of the suspended contact for 10 days, existing screening for outbreak passengers from area with recent local transmission by asking, questioning and temperature measurement. Disinfection of aircraft and crucial vessels having SARS case on board using WHO guidelines. The personal preventive measure to prevent spread of virus include frequently hand washing using soap or alcohol based disinfectant. For those with a high risk of contracting the disease, such as healthcare worker use of personal protective equipment, including a mask, goggles, and apron is mandatory. Whenever possible, household contact should also wear a mask. Now, we are discussing the influenza, commonly known as a flu, which is commonly known as a flu. Influenza is a virus infection that attack your respiratory system. These all the disease of respiratory system, your nose, throat, and lungs. Influenza is commonly called the flu, but it is not same as stomach flu viruses that causing diarrhea and vomiting. For most people, the flu resolve on its own, sometime sometime we can say influenza its complication can be deadly. People at higher risk of developing flu complication include the young children under age of 5 and especially those under 6 months, elder older than 65, basically the elders, that is older than 65, residents of nursing homes and other long term care facilities, pregnant women and women up to 2 weeks and given birth, people with weakened immunity system, Native Americans, people who have chronic illness such as asthma, heart disease, kidney disease, liver disease, and diabetes. Through the annual influenza vaccine is not 100% effective, it's still your best defense against the flu. The symptoms of influenza are as follows. At first time, the flu seem maybe like the common cold and the running nose, sneezing and sore throat, but the cold usually develop slowly, whereas the flu tends to come on suddenly. And although a cold can be bothered, you usually feel much worse and with the flu. Commonly, sign of symptoms of the flu include the fever, aching muscles, chills, sweats, headache, dry, persistent cough, shortness of breath, tiredness and weakness, running in stuffy nose, sore throat, eye pain, vomiting, and diarrhea. But this is more common in children than adults. Most people who get the flu can treat themselves at home and often don't need to see a doctor. But it is compulsory to see a doctor. It is very compulsory to see a doctor. So when you feel such type of symptoms, you always to see a doctor. If you have a flu symptoms that are the risk of complications, see your doctor right away. Taking antiviral drugs may reduce the length of your illness and may prevent the more serious problems. If you have emergency sign and symptom of the flu, get medical care right away. For adult, emergency sign and symptoms can include difficulty breathing, shortness of breath, chest pain, ongoing dizziness, seizures, worsening of existing medical conditions, severe weakness or muscle pain. The emergency conditions are difficulty breathing, blue lips, chest pain, dehydration, severe muscle pain, seizures, worsening of existing medical condition. The causes of influenza virus travel through the air in droplet when sometimes with an infection, cough, sneeze or talks. You can inhale the droplets directly or you can pick up the germ from an object such as telephone or computer keyboard and then transfer them into your eyes, nose and throat, mouth. People with the virus are likely contagious from about a day before symptoms appear until about the last 5 days they start. Children and people and weakened immune system and the contagious for a uh, slightly longer time. Influenza virus are constantly changing with new strains appear regularly. If you have had influenza in the past, your body has already made antibodies to fight the specific strain of the virus. If future influenza virus are similar to those you have encountered before, either by having disease or by getting vaccinated, those antibodies may prevent infection or lessen its severity, but antibodies levels may decline over time. Also, antibodies against influenza virus you have encountered in the past may not protective you from new influenza strains that can be very differentiate virus from what you had before. The risk factors are the age more than 65 years or old, living in working condition, people who are such as nursing homes, military backups, and more likely to develop the flu. Weakened immunity system, cancer treatments, anti-rejection drug, long-term use of steroid, organ transplant, blood cancer, HIV/AIDS can weaken your immunity system. So we can aware from this type of changes. The racist Native American people may have increased risk of influenza complication. Aspirin use under age 19. People who are younger than 19 years of age and receiving long-term aspirin therapy are at risk of developing race syndrome if infected with influenza. Now, pregnant women are more likely to develop the influenza complication, particularly in the second and third trimester. Women are more likely to develop influenza related complication up to 2 weeks after delivering their babies. And the obesity is the main reason of influenza. There are some treatment strategy of influenza. We can control the spread of influenza, wash our hands, avoid touching the faces, cover your cough and sneezes, clean surfaces, avoid crowds, take appropriate medicine, medicines, antiviral drugs, antiviral treatment for the 3 to 5 days must be started within the first 2 days. So these are some precautions we can clearly far from the influenza virus. Now we are going to discuss the cholera. Cholera is an infectious disease that causes severe watery diarrhea, which can lead to dehydration and even death if untreated. It is caused by eating food and drinking water contaminated with a bacterium called Vibrio cholerae. So Vibrio cholerae is the causative agent of the cholera. So, cholera was prevented in the US in the 1800s, but modern water and sewage treatment system eliminated its spread by contaminated water. Only about the 10 cases of cholera reported in each year in US, and half of these are acquired abroad. Rarely contaminated seafood has caused cholera outbreaks in the US. However, cholera outbreaks are still in a serious problem in other parts of world. The World Health Organization reports that there are 1.3 million to 4 million cases each year. Means there are lots of cases of cholera. The disease is most in places with poor sanitization, crowding, war, and the famine. Common location include parts of Africa, South Africa, Latin America. If you are traveling to one of those areas, knowing the following cholera fact can help protect you and your family. What are the causes of cholera? Vibrio cholerae is the causative agent, the bacterium that causes cholera, as usually found in food or water contaminated by feces from a person with the infection. Common sources include the municipal water supplies, the ice made from water, food and drinks sold by street vendor, vegetable grown. So these are the common causes of cholera. Now, the symptoms of cholera, the rapid heartbeat, the loss of skin elasticity, the dry mucous membrane, the low blood pressure, thirst and muscle cramps. These are some basic symptoms of cholera. And in case of if the person has suffering from cholera, so the eight key items for a cholera response, they should take the antibiotic, they should take the cholera bed separately, cleaning the equipment properly, oral rehydration salts is due to diarrhea. They use the plastic sheets, the protective cloths, and choline. So these are the basically symptoms, these are the basically measurement during cholera. Now I am going to discuss the malaria. The malaria is a life-threatening disease. It is typically transmitted through the bite of infected Anopheles mosquito. Infected mosquito carry the Plasmodium parasite. When this mosquito bites you, the parasite is released in your bloodstream. Once the parasite are inside your body, they travel in the liver. When they mature, after several days, the mature parasite enter the bloodstream and begin to the infected red blood cells. Within 48 to 72 hours, the parasite inside the body cells multiply, causing the infected cells to burst open. The parasites continue to infect the red blood cells, resulting in the symptoms that occur in cycles that last 2 to 3 days at the time. Malaria is typically found in tropical and subtropical climate where the parasite can live. The World Health Organization stated that in 2016 there was estimated 216 million causes of malaria in 91 countries. It is in the United States, the Center of Disease and Prevention report 1700 cases of malaria annually. Most cases of malaria develop in people who travel to countries where malaria is more common. What are the causes of malaria? Malaria can occur if the mosquito infected with the Plasmodium parasite bites you. There are four kind of malaria parasite can infect human: Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, and Plasmodium falciparum. Plasmodium falciparum cause a more severe form of the disease who then those who contact in the form of malaria have a higher risk of death. An infected mother can also pass the disease to her baby at birth. There is known as congenital malaria. Malaria is transmitted by blood, so it can also be transmitted through an organ transplant and transfusion, use of shared needles or syringes. What are the different symptoms of malaria? Shaking, chills that can range from moderate to severe, high fever, profuse sweating, headache, nausea, vomiting, abdominal pain, diarrhea, anemia, muscles pain, convulsions, coma, and bloody stool. How the malaria is diagnosed? Your doctor will be able to diagnose malaria during your appointment. Your doctor will review your health history, including any recent travel to tropical climate. A physical exam will also be performed. Some tests are whether you have malaria, what type you have malaria, if your infection is caused by parasite that is resistant to certain type of drug, if the disease has caused anemia, if the disease has affected your vital organ. The life-threatening complication of malaria are swelling of blood vessels of your brain and cerebral malaria, and accumulation of fluid in the lungs that cause breathing problems, organ failure of the kidney, liver, anemia due to destruction of red blood cells, low blood sugar. How the malaria is treated? There are lots of anti-malarial drugs like one for aminoquinones. The chloroquine will be there, amidoquine, piperacillin will be there. The quinoline, methanol, the mefloquine will be there. The biguanates, the proguanil will be there. The diaminopyrimidine, pyrimethamine will be there. The 8-aminoquinoline, primacune and teflocune will be there. The sulfonamides and sulfone, sulfadoxine, sulfapyroxacin, dapsone will be there. There are lots of antibiotics will be there like tetracycline, doxycycline, clamidacine. Neflofitridine, the pyroheridine will be there, and the nefloquinone, the atovamin will be there. So these are the drugs. By the help of these drugs, we can treat the malaria easily. There are lots of tip to prevent malaria. There are no vaccine available to prevent malaria. Talk your doctor if you are traveling to an area where malaria is common. If your life such an area, you may be prescribed medication to prevent the disease. These medications are same those used to treat the disease and should taken before, during, after your trip. Talk your doctor about the long-term prevention. If you live in an area where malaria is common, sleeping under a mosquito net may help preventing being bitten by infected mosquito. Covering your skin and using bug spray contaminated may also prevent infection. So these are the some prevention of regarding malaria. So the basically one point will be clear: the non-pharmacological treatment always better than the pharmacological treatment. Sleep with a mosquito net, you have no malaria in future. Thank you so much for kindly listening for this presentation.